Good morning, sir. Thanks for coming. I'm Mr. Jacobo, your pharmacist for today.
Good morning too. As for what I've heard, you'll be the one to assess my medications.
Yes, sir. I will be the one to assess your medications. Our appointment will be focused on identifying all of the medications you're taking, as well as any potential medication-related problems or cost-saving options. I'll send your new medication list once we've finished.
Okay, thank you.
According to your medical record, you have a history of hypertension, dyslipidemia, benign prostate hyperplasia, osteoarthritis, gout, chronic kidney disease, anemia, and elevated ACR level a month ago. Is there anything that I've forgotten, sir?
Yes, you're right.
By the way, sir, an elevated ACR level means you have chronic kidney disease.
Yes, I can remember that now.
So let's start, sir. I see you're taking Ramipril 5 mg and Amlodipine 5 mg on your record. How do you take these two medications, sir?
Yes, I used to take Ramipril and Amlodipine for my blood pressure every day, right?
Okay, sir, that's correct. Next, how do you take your 20 mg of atorvastatin?
I believe it's for cholesterol. I take one before going to bed.
Yes, sir, that is for your high cholesterol. I noticed that you are taking dutasteride. How do you take this medication, sir?
I've started taking one tablet of dutasteride every day for a few years, and I just began taking iron about a month ago.
Okay, I'll take it into consideration. Are you getting any injectables or antibiotic at the moment?
No, sir.
Are you currently using any medication samples?
No, sir.
Do you take any medication for pain?
I have prescription for indomethacin that was given to me for gout.
How do you take that, sir?
I used it for a few days about 3 months ago and it seemed to work really well. I haven't used it since.
Okay, sir. What about over-the-counter medications? Are you currently using them?
Yes, I sometimes use 200 mg of ibuprofen to relieve the pain for my osteoarthritis.
How do you take this medication, sir?
I only use this sometimes over once or twice a month only. It appears to be effective for my osteoarthritis. However, every time I take it, I notice that it irritates my stomach.
Well, that's excellent because you can see how well it works to relieve your pain. It is a side effect of the drug that causes the stomach discomfort. Instead, I recommend taking paracetamol, which is gentler on the stomach, and unlike ibuprofen, it will not raise your blood pressure.
Thank you for the tip, sir.
You're welcome, sir. I will be going to discuss more about that later. What are the other adverse effects do you remember having besides an upset stomach?
I don't think I'm experiencing any other adverse effects aside from that.
Okay, sir, I'll take note that. Please do not hesitate to contact us or your physician if you experience another one in the future.
Okay?
Do you monitor your blood pressure at home?
Yes, my son's wife is a barangay health worker in our barangay. She always monitor my blood pressure.
That's great, sir. Based from your medical record, I see that you are taking a number of drugs at the same time, and patients frequently miss doses. How do you deal with a problem like this when it comes to taking your medication, sir?
My wife and I make an excellent team because we both take drugs in the morning and evening. As a result, we make certain that we do not forget. However, if I had to check, I believe I miss 1 to 2 doses per month.
I believe that cannot be avoided, but I am glad to hear that you and your wife, sir, are assisting each other and remembering to take your medications. Please continue to do that.
Okay, sir.
How do you feel your medications are working for you?
Things seems to be going well. My blood pressure is good and I don't have any urine problems anymore. Therefore, my prostate appears to be stable.
Great, sir. Do you suffer from any food or medication allergies?
I'm not allergic to any medications or food that I am aware of.
Okay, do you exercise?
Yes, I go for a walk with my wife 3 times per week. It's about 15 minutes each way.
Nice, sir. Do you drink alcohol?
On average, I have 2 drinks every week.
Do you smoke or have you ever smoked?
I used to smoke for a long time but I stopped approximately 10 years ago.
How about drinking any caffeinated drinks, sir?
Yes, I have an espresso every morning and tea in the afternoon. I've been doing this for years.
Okay. Next, how is your diet, sir?
We do eat a balanced diet with less meat and more fruits and vegetables.
Wonderful, sir. Do you have any family that also have a history of present condition?
Yes, my sister, she has diabetes.
Okay, sir, I've taken careful note all of them. While we were discussing, I discovered several adjustments that I can recommend to your physician and to you afterwards. The first is that you should not take indomethacin with ibuprofen because they are both NSAIDs and may increase your risk of experiencing its side effects such as the upset stomach that you stated earlier.
Okay, I'll keep in mind.
Don't worry, sir, I'll send you the updated medication list as well as the things we talked today, so you'll be able to recall them if you think you've missed something.
Okay, thank you.
Then there's the fact that long-term usage of NSAIDs like indomethacin and ibuprofen can inflict damage on your kidney function and complicate your chronic kidney disease. Additionally, stomach upset and high blood pressure are risks, thus I recommend discontinuing these medications and replacing them with paracetamol 500 mg to 1000 mg 4 times a day as needed for osteoarthritis pain and gout, and replacing indomethacin with allopurinol, which are both safer NSAID alternatives.
Thank you, that was a great idea.
I've also discovered a problem with your ramipril intake. The dose is insufficient or too low for your situation and it may aggravate your chronic kidney disease. Despite the fact that this drug is effective in preventing chronic kidney disease, you still have high levels of protein in your urine which need further treatment. As a result, the ramipril dose, which reduces protein in urine, should be increased to 7.5 mg per day.
Okay.
I also recommend that you should have your serum potassium levels evaluated again in 2 weeks, since this test is used to evaluate diseases related to abnormal potassium levels such as renal disease and high blood pressure.
Sure, sir, thank you.
Do you have any other questions or concerns aside from we've already discussed, sir?
Nothing, sir, thank you so much.
You're welcome, sir. I'll send you an updated medication list after checking with your doctor about the changes and recommendations we discussed today. I also get in touch with you once I've confirmed the changes to your medication with your doctor.
That's great, I really appreciate your effort, sir.
I hope you will continue to take your medications as directed. If you have any queries or issues, please do not hesitate to contact us.
Sure, sir, thank you. I'll be looking forward to discussing with you again soon.
Thank you for your time, sir. I'll get in touch with you later.
Thank you again, sir.
Thank you, sir. Have a good day.